Our studio guest for this morning.
Yes, we have Dr. Bhavesh Doshi here, who's the senior consultant gastroenterologist at Gleneagles Hospital, who is going to talk to us about all things tummy related. And it's more than that. I'm just keeping it in layman terms. He's going to tell us more about gastroenterology. And we want you guys to also contribute if you have any questions.
That's right. You can chime in with your questions because I'm very sure, the doctor is in. Give us your questions, share with us your comments, and it might just win you a 3 hours art jamming workshop for two. This is worth $110 from Sims Galleria. So welcome to the studio. Let's start us off. Tell us a little bit maybe about yourself.
Okay. Well, first of all, thank you very much for having me on the show.
Pleasure.
It's a real joy to be here. Well, my name's Bhavesh, as you've heard. I'm a gastroenterologist. I've been in private practice for just less than a year.
Okay.
And before that, I used to be in National University Hospital
Wow.
as a senior consultant gastroenterologist.
Yes.
And I've decided to take the leap and move into private practice. And I felt like our information that we sort of put out there for our public needs to be slightly strengthened, and we probably need to discuss a few things to educate and help our audiences sort of understand, really.
Perfect. And this is a great platform to do that.
Yep.
Yes.
So to that end, Doctor, can you tell us what exactly is gastroenterology in the simplest of layman terms? Because people think gastro, they think immediately stomach only. Is it more than that?
It is. It is. So it's technically it's gastroenterology and hepatology.
Okay.
And that involves the care of anywhere between the mouth and to the back passage.
Right.
So that involves the stomach, the colon, the small intestine, the esophagus, the pancreas, the liver.
That's a lot.
That's a lot. Yeah, lots of major organs in the abdomen. Actually.
I just want to say thank you on behalf of everyone tuning in and myself for taking such big care of such a huge. That's
a lot of area.
More than 50% of the body.
Yeah, absolutely.
So, what are some of the most common gastrointestinal problems that you encounter?
Yeah, so look, I think the commonest that we see is something called dyspepsia, which is just acid-related symptoms.
Right.
The easiest way to describe it is just indigestion.
Yeah.
So that's probably, as a specialist, that's what we would see. I think in primary care, it might be slightly different. So in primary care, you might potentially see gastroenteritis, diarrhea, and those sort of symptoms that are not that uncommon. So slightly different from what the GP sees. Yeah.
Is this known as, it's like acid reflux, right?
Yeah,
it's
that's
most
right.
common. We're going to jump onto Facebook Live right now. Join us at facebook.com/1FM913. And let's speak a little bit more about this acid reflux. It's so common. Mm-hmm. So join us then for the conversation. And remember, chime on in with your questions. You can post it by commenting on our Facebook Live. Good morning, everyone. Look at this handsome Jen in our studio. Hello. Good morning,
Hello.
Dr. Doshi. And yes, we were talking on air about how one of the most common problems that you do see is related to acid. I mean, layman terms is
it's called
acid reflux.
Dyspepsia, right?
Yeah, so a slight difference between dyspepsia and reflux.
Okay.
But the mechanism can be similar in both situations. So it's predominantly related to acid. Acid in the stomach, which is dyspepsia. Acid that comes up in the esophagus, which is reflux.
So I got it wrong. So it does two different things.
Yeah.
But the most common is the one in the tummy.
Yeah, that's probably what we see the most frequently, yes.
Very fun, quick fact is Pepsi was invented to battle dyspepsia back in the. That's why the Pepsi name is from that. Yeah.
Oh, wow.
Are you learning something new today? I'm available for
consultation.
Boring.
That is so interesting.
Yeah, that's why Pepsi and dyspepsia came.
Because I was wondering, that reminds me of a drink. This condition.
Yeah, that's right.
So
but they do it to settle the stomach. A lot of people have the gassy drink as you well know, right?
Yeah. That's right.
Really?
That's right. Yeah.
That is the treatment.
Yeah. No, it's not the treatment. It'll probably
you see how quick it was.
I am layman here.
No, so You're right. I mean, there's a lot of people that still believe that if you've got an upset tummy, particularly if you've had an infection, a bug, drinking Coke or drinking Pepsi helps. I've tried it myself, and I must say it's...
Is it comforting but not actually helpful? What is it?
I don't know. I felt... I guess the sugar rush is good, right? So
that helps.
That definitely helps. But dyspepsia per se is acid in the stomach, and that can get worse if you have a carbonated drink or if you have...
it can.
Yeah, that's right. So it's
so
best
guys,
to avoid that. Yeah,
don't do it.
Yeah,
This is kind of like debunking a myth here.
Yeah.
Because I mean, my grandmother would say, that generation actually taught me, like, oh, your tummy's not feeling good, do this or do that.
Wow, this is the power of marketing. Honestly. Okay, so you've told us not to go with the gassy drinks
if you have indigestion.
If you have indigestion.
Yeah.
So what causes these sort of things? Acid reflux, dyspepsia, heartburn, and how do we deal with it?
Yeah, so the cause is very complex. We can have patients who have terrible symptoms of acid in the stomach. And when we do an endoscopy, when we do a scope to have a look inside, we may not find much inflammation. We might find very mild inflammation. And at the same time, we can have patients that have really mild symptoms. And when we do an endoscopy, they can have quite a large ulcer in the stomach or a lot of inflammation. So the correlation between what we see inside and what the patient experiences doesn't have to fit in.
There could be a disparity there.
Absolutely. So I think oftentimes we don't know before we've done the endoscopy on the patient. So we would recommend that if they have symptoms of dyspepsia and if it's persistent and it's not getting better with medication, then it's better that we do an endoscopy and find out what's the cause, basically.
Wow, goodness. Yeah. This is really like, I've been told that it is very important, as like say you're in your 40s, is it, to get a colonoscopy? Is that true?
Yeah.
Or is that a myth that we're debunking today?
Yeah, no. So, we have a colon cancer screening program in Singapore. So anyone over the age of 50 is potentially eligible for a colonoscopy. And, we call it a colon cancer screening program.
Okay.
But that kind of puts fear into people's mind that they think, oh, we're checking for cancer.
Right.
But there's actually a very good reason for doing a colonoscopy in your late 40s or from your 50s onwards, actually. And that is that we often find the precursor to cancer in the colon. The precursor is a polyp.
Right.
So if you find a polyp and you remove that polyp, you actually reduce your chance of getting colon cancer in the future.
That is very interesting. And I've also been told that actually colon cancer is very treatable if you detect it early.
Early, and if you detect it at the polyp stage, it's treatable in 5 minutes. You
can remove the polyp and
you remove the polyp and you don't have the cancer.
And there's no like post-treatment that's needed.
No, if the polyp is removed before it forms a cancer, then that's it. That's all you need.
We need to share this with everybody on air. We're going to jump on air right now. Join us, everybody, on 1FM 91.3. Hope you enjoyed that one from Mark Ronson featuring Amy Winehouse, the late Amy Winehouse, with Valerie here on the Bright Side. Good morning to you. We are joined in the studio with this distinguished gentleman, Dr. Doshi, to talk about, gastrointestinal, tummy. We just spoke about on air. We need to share this two things with everyone that we spoke on Facebook Live. Number one, the myth about
gassy drinks when you have an unsettled stomach. You're saying try to avoid that, actually.
Yeah. So if you've got acid related symptoms, upper part of your tummy, burning sensation, I would suggest you avoid carbonated drinks because that can make it potentially worse.
Okay. So, all this while, we've all grown up being told, have that to settle.
Correct.
And it just makes you feel better. And as you say, it's probably the sugar rush rather than anything else.
Yeah. It may not be such a bad thing in people who have diarrhea in terms of rehydrating them. It's just fluids.
Right.
But, there are better rehydration fluids. There's so much better rehydration
electrolytes
fluids.
And stuff, right?
That's right. So Coke is probably, or Pepsi is probably not the best. But each
Well,
to their own.
each to
So
their own.
I guess if it helps, then go for it.
Let's just say that when I was young, I look forward to having a tummy upset so that I can drink some Coke.
That was the reason to have it. Exactly.
The other thing we discussed on Facebook Live
Yeah.
is that whole need
Yeah.
to begin your screening of your colon. When should that be, and
Yeah.
why is that so important?
Right. So the official age is 50. So from the age of 50 onwards, you can have a screening colonoscopy. You can have there are many different ways of screening the colon. You can do a fecal blood test, which detects whether you have blood in the colon or blood in the stools. And that's a good way. As a mass screening program, that's a very good way of
Uh-huh.
picking out patients that potentially might have problems in the colon. Doesn't necessarily mean that you have a problem if you have blood in the stools. The most common cause is just hemorrhoids or piles,
Right.
which are totally benign and then they're relatively
right?
harmless.
Yeah.
Treatable
Yeah.
and harmless.
But it's good to find out.
It's good to know
yeah.
because until you've had your scope, you would not know basically.
That is true.
Sorry, just to interrupt. So you're saying a fecal test
Yeah.
is as good as having a colonoscopy?
No. A fecal
Okay.
test is the
Precursor.
preliminary
Ah,
step
okay.
before you have a colonoscopy.
Okay.
But you don't necessarily need to have that. You can go straight to a colonoscopy.
Okay.
I did that for myself and
Okay.
my family members. So just straight to a colonoscopy. Yeah.
Now, a lot of people get scared
Yeah.
when they hear colonoscopy.
That's
to be
true.
to be honest, I've had one
Yeah.
because my family had a history
Right.
of colon cancer, and I had one in my 20s.
Right.
Oh.
I think
Yeah.
just to be safe, kind
Oh,
of thing.
okay.
I got to be honest, it
Yeah.
wasn't the most pleasant experience
Yeah.
I've ever had.
Yeah.
And I had I was spit roasted because I had the
What?
gastroscope
Yeah.
as well at the same time.
Not at the
Oh,
same time, not at the same
no.
moment, but
I had one going down my mouth,
Yeah.
one going up my.
but it would have been done sequentially. So they would
Right.
have done the top first and then
Okay.
and then turn the bed around and done
It just
the
I
bottom.
felt like
Yeah.
I was being turned
think-
around and
Well,
It wasn't-
I can
Sounds
imagine
like
it felt
a
that,
very
yeah.
traumatic experience for him, even though it
no.
was maybe one after the other
Yeah.
as per procedure. I
Yeah.
think to him it felt like
it
no.
probably felt.
Yeah.
But also, like, how do we allay those concerns for people
Yeah.
Yeah.
about having a colonoscopy?
Okay, so the great thing about having it done in Singapore,
Yeah.
in any location, is that it's done under full sedation.
Yeah.
So we give sedation to all our patients. I've worked in countries where endoscopy is done without sedation.
No.
Yep. So and the top, which is to me, I would feel that it needs sedation. I've had 2 endoscopies from the top, 2 from the bottom, and for both of them, I've had sedation.
So you went to sleep before it all happened. You woke
Yeah.
up. It's all done.
That's
no
right.
recollection.
That's right.
Okay.
And the next thing you know, when you wake up, you just want to have something to eat.
Okay.
And
There's no residual pain or.
no, about 10% of patients might have mild sore throat,
Okay.
but just really mild, and it may last for one night, and then
Okay.
it settles down after.
Okay.
Yeah.
Okay. So that's important to know. I think for everyone who's a bit worried.
Indeed so. But you were mentioning that it's important to do it.
Yeah.
Why so?
So, it goes back to this precursor of cancers. We want to detect lesions before they require surgery, before
Okay.
they require chemotherapy. If we can find a polyp and remove the polyp before it becomes a cancer, it takes us 5 minutes maybe to remove it, and that the job is done. And the patient doesn't end up having, years later, doesn't need to have surgery, doesn't need to have chemotherapy, and all the
Wow.
pain and trouble that brings along.
And cost
Yeah.
as
And the
well,
cost, that's right.
and
Yeah.
just how it really can affect your health with the
Absolutely.
recovery and all that. So
Yeah.
it's beneficial
Yeah.
all in all.
Yeah.
Go and get your colonoscopy done. What are the ages again? Is your son in your late 40s, or you said from
Yeah.
50 onwards?
So look, if we're doing it as an official cancer screening program, then it's from the age of 50 onwards, unless you have a strong family history of
Yeah.
colon cancer, in
Okay.
which case you do it much younger.
Okay.
So you are right to get yours done
Right.
earlier.
But should I? Because that was my 20s. I should probably go again.
Yeah, if you have a strong family history, I mean, I haven't asked you your age yet,
Yeah.
so
I'm not far from 50. I'll
Yeah.
tell you that.
Yeah.
Oh.
I'll tell
Well,
you that.
I'm just below 50, and I've had
Right.
2 sets of scopes myself.
Okay, so I should-
So
Well, I
should,
guess,
you know,
doctor, you're walking the talk.
Yeah.
You know what I mean? You're walking the talk,
you have
telling your
to
patients
you have to
that
demonstrate it to your patients, right? You have
That's
to show
right.
it. Yeah.
We're going to jump onto Facebook Live, and we've got some great questions about just that whole idea. What happens when you have a tummy ache? What should you look out for? When is it serious? When is it more than just a tummy ache?
Right.
Find out and join us on facebook.com/1FM913. Hi, everybody. We're back here on our Facebook Live. And yes, with Dr. Doshi and the question at hand. This is a really, it seems simple, right? Everyone gets a tummy ache once in a while. But when should I be worried about a tummy ache?
Yeah. So I guess you're right. Tummy ache is very, very common. We see it in the vast majority of patients that come and see us. The thing that we would get concerned about is if there are additional features and chronicity. So if it's been happening for a while with additional features like weight loss, unexplained weight loss, or other things like change in bowel habit, so either diarrhea or constipation, something new that's developed,
Okay.
then we would certainly be concerned about that, and we would request for investigations to try to find out what the underlying cause
So
is.
don't ignore
Yeah.
things that might be a little bit different now in your
Yeah.
bowel habits, right?
Yes.
Bowel movements and
Don't
stuff.
brush it off. Don't just
Yeah.
live with it.
That's
Yeah.
right.
Could this happen? Should this be for all ages? Like even if my kids experience it?
I mean, look, kids generally tend to have a bit of a tummy upset anyways, because of what they eat, and if they're anything like my kids with
Don't wash hands.
Putting
Yeah.
fingers in mouths
That's my
and
kids.
all that kind of
exactly.
Yeah.
Diet and stuff. So, look, I guess kids, we could take a wait and watch approach, basically. But I think for adults, particularly, it's important to get that looked at.
Sure.
And if you could try, I mean, your doctor might give you some medications first and see if it settles down. And as long as you're below the age of 50 and it settles down, then it should be
Should be all
okay.
right. Okay.
But if you're not sure, come and see a specialist, and we can get the test done for you. But if you're over the age of 50 and there are new symptoms, I would definitely recommend
Do
that
not
getting
ignore
looked
that
at.
for sure.
Ah.
Okay.
Absolutely. Yeah.
We have a question from Dovi Penalosa.
Great.
Which is an interesting one.
Yeah.
Is it true that taking acid medication prevents you from getting drunk?
Sorry? What is
yeah,
this?
No, look, so
Is
there's
this a common misconception?
There's the anti-acid medicine which we use for dyspepsia or reflux,
Okay.
right? And many people might take it before they have an alcoholic drink if they know that the alcoholic drink is going to give them acid symptoms.
see.
So yes, from that point of view, the medication does reduce the acidity, and it might settle your tummy.
Okay.
You might not have as much of a tummy upset the next day.
Okay, that doesn't mean it doesn't stop you from getting drunk.
No, it doesn't stop you from getting drunk. So
Okay.
unfortunately, it doesn't do that.
Nice try. Nice try. But I, on a serious note, if you do tend to have acid, and you want to have a drink or two,
Yeah.
then do pop an antacid or whatever.
Yeah. So look, if you're going to go out for dinner, you're going to have a glass of red wine, and red wine is particularly
Acidic.
acidic, and it does
okay.
cause
Yeah.
these symptoms. Then it's and you're susceptible to it. Then
Yeah.
you can take a tablet. You can take one of these acid-reducing medications.
Okay.
Right. This is a really quite a broad thing that we're about to ask you, but let's take it through and also bring it back on air. What are some harmful myths and misconceptions about, gastrointestinal problems?
Okay, that's a really good question. And so the thing that I see most common in my practice, and especially in my practice, I deal with a lot of bile duct and pancreas problems. One of the things that we find very difficult to convince people is when their gallbladder is diseased, so there is inflammation, when there is damage to their gallbladder, that they need to have their gallbladder removed.
Yeah.
And many patients
Don't
are
want to.
reluctant to have it done. We try to explain to them that it's a little bit like your tonsils or your appendix. You don't actually need it. And it's not essential
Right.
for your function.
Is that so?
Absolutely.
I always thought
Yeah.
it produces something that I need in my digestion.
It doesn't, but it acts as a reservoir. So it acts as a reservoir for your bile. So you're right in that sense that it has juices that help you with your digestion, but it doesn't
Right.
produce it. It just holds it, and that's produced in your liver.
But you have to be careful after you have it removed with your diet. Am I not right? with
Yeah,
that?
so I mean, look, it actually for all the patients that I have sent
Yeah.
for a cholecystectomy, which is a removal of the gallbladder, they
Okay.
come back saying that, look, doctor, I'm on a healthy diet now, and
Okay.
having the surgery has made me go on a healthy diet.
Okay.
So
That's
We're
another
gonna
good way to look at
talk
that.
more
Yeah.
about that in just a bit because we're jumping back on air. Join us, everybody, and let's talk about these myths and misconceptions about GI problems. China Phillips here on the bright side with Naked and Sacred. And my goodness, what a great chat we're having with Dr. Doshi here in the studio, all about the gastrointestinal problems, misconceptions, and also myths. And actually, we debunked a little bit of that on Facebook Live just seconds ago. And we're going to carry on with the topic because we asked you what are some of these harmful myths and misconceptions about GI or gastrointestinal problems. And you mentioned about disease gallbladder removal. So could you take us through that once again?
Yeah, so most people have healthy gallbladders. They have no issues with their gallbladder. Some patients may have stones in their gallbladder, and they're absolutely fine. They don't need to have the gallbladder removed. There's a very small proportion of patients who have stones in the gallbladder where the gallbladder gets into trouble with the stones. So either infection, inflammation.
Okay.
Rarely one of those stones drops out into the bile duct and causes a blockage of the bile duct because the gallbladder is connected to the bile duct, which is coming from the liver.
Sounds painful.
That is extremely painful. It is, unfortunately. Okay. So in those circumstances, in that small group of patients, we would recommend that they have their gallbladders removed. Not everyone.
Okay.
Not everyone with a stone in the gallbladder needs to have the gallbladder removed. It's just that small proportion of patients. Yeah.
And what I'd asked you earlier as well was, how does that affect, say, diet and all that after removal?
So typically, patients tend to go on a low-fat diet. Because they realize that on a high-fat diet without their gallbladder, they might not be able to digest all the fat in their diet.
Sure.
So they tend to naturally just go on to a healthier diet.
As in, like, it makes them feel uncomfortable when they go on a high-fat diet, or what are the symptoms that we're seeing?
Some patients who've had their gallbladder removed may find that they get a little bit more loose motions or softer motions when they have excessive fat in their diet.
Right.
So they tend to watch their diet and eat healthier, basically.
So we do become healthier.
Yes, absolutely.
And spicier as well, was that?
No, spicy foods generally, I mean, they might cause pain and discomfort, but it's more related to the acid in the stomach causing the spicy food.
I see. But you're saying that it's a harmful myth that people believe in because they don't want to have the gallbladder removed. You said that on Facebook Live, right?
Absolutely.
And actually, it's okay to have it removed.
Yeah, I mean, there are plenty of people without their gallbladder, without their tonsils, without their appendix who are doing absolutely fine.
Exactly.
That's true. So basically, the gallbladder, like you were saying, is just a reservoir. It holds,
a reservoir,
but the stuff that it holds actually comes from the
liver. It's the bile juices that are produced by the liver and contained within the gallbladder.
I should have paid more attention in my biology class, but I learn now.
So, Doctor, before we let you go, I mean, let's talk about some of the key takeaways from a gastroenterology perspective. What would you advise people to do out there?
Okay, so I think we've covered most of the important things. I think if you develop symptoms and if they're persistent, they don't settle with medications, don't wait.
Right.
Get it looked at. Go and see your doctor. Get your GP to get you to be referred to a specialist. Get that checked out. There's lots of tests that we can do these days to detect these symptoms.
Okay.
With regards to colon and polyp and what's called cancer surveillance or cancer screening, I think it's important to get that done because we're not necessarily just looking out for cancers. We're looking out for the precursor, and that takes a few minutes to treat. And that prevents you or reduces your risk of getting cancers in the future for colon.
Okay, important.
So I think that's an important point actually, and that's something, the uptake is good in Singapore. It's pretty good.
Right.
It's comparable to the rest of the world.
Okay.
But we need to get out there and we need to highlight that to patients even more.
It needs to go up some more. Is that what you're saying?
Yeah,
because 5 minutes of just removal compared to years of like the chemo, the surgery.
That's right. The colonoscopy itself takes maybe about if we do take our time to do the colonoscopy, it's important that we spend a bit of extra time because we want to make sure we don't miss any polyps. So the colonoscopy itself might take 20 minutes, an additional 5 minutes to remove a polyp. And that's it. That saves you, as you said, surgery, chemotherapy.
A lot of discomfort later on.
I just want to say that I've had some of my best naps under GA.
Yeah, absolutely.
That's the best sleep, and boy, did I need it. Right. I woke up feeling refreshed. I'm like, hey, this is great.
Absolutely.
So, Doc, how can people get in touch with you or find out more if they want to, have a consultation or anything like that?
Yeah. So we're on Google. If you just Google Gastro Health. will come up. GastroHealth Singapore will come up.
Okay.
Dr. Doshi or Bhavesh.
BHAVESH, by the way.
Yes, that's right.
Okay.
Yeah.
We'll definitely share the details with you on our Instagram as well as our Facebook Live. But
you.
let's thank Dr. Doshi for joining us
Thank
here
you so
on
much.
1FM.
Thank you very much,
Anthony.
both of you, for having me this
Our
morning.
pleasure.
Okay.
Good times. Greatest hits. 1FM 90.